A national conference on incontinence has brought the world's leading bladder and bowel health specialists to Sydney. They're in Australia to discuss how to help the close to 5 million Australians over the age of 15 who are incontinent.
Now, while bladder and bowel dysfunction might be a little difficult to talk about, there's a few women trying to lift the stigma and open the floodgates of conversation. Well, joining us now is the chair of the conference's scientific committee and urogynaecologist at Westmead Hospital, Dr. Jenny King, and the Continence Foundation of Australia's Dr. Beth Wilson. Good morning to you both. Thank you very much for joining us in this conversation that we need to have. You know, it's nearly 5 million Australians who are suffering from these symptoms, bladder and bowel incontinence. Difficult though to talk about, isn't it, for a lot of people?
Look, it is. Unfortunately, it's seen as firstly embarrassing. So no one wants to be the poster girl for incontinence. So it's very hard to make it
I
do.
You don't mind volunteering. Well done. Yeah.
I'm the patron of the Continence Foundation of Australia, and when I retired as Victoria's Health Complaints Commissioner, they approached me and I thought, yeah, I've got a personal interest coming from a family where quite a few of us have what's called stress incontinence. So that is leakage of urine if you jump or dance or make sudden movements. In fact, one of the papers at the conference that I found really interesting was on netball players, because that's a sport that's very, very popular with women as they're getting older, particularly in the regions. It's a social activity as well as a sporting one. But it's an activity that means you have to jump, twist, move direction quite quickly. And there was a high prevalence of continence problems amongst those women.
So there you are. And it is a problem that affects women, 80% of the cases.
Mostly women and mostly women who've had children, but not always. I haven't had children. First time I went to see a doctor and mentioned the problem, the response I got was, well, what are you doing with that? You haven't had children. So I was a double sinner. I was child-free as well as having incontinence.
Jenny, I guess that's a point that you want to make, is that incontinence, be it issues with the bladder or the bowel, it's not necessarily a natural part of ageing or even having children.
Not at all. Look, ageing makes all bladder and bowel problems worse. Ageing makes everything worse. But I'm not promising we can fix everyone, but there are a lot of people out there we could make a lot better and make them able to participate in their lives much more fully than they are at the moment. If you're worried about your bladder and you might get up at night and you might have an accident, you're not going to go out. You're not going to go on family activities as much as you would. You're certainly not going to go on holidays. People with really bad bladder and bowel problems, even in younger life, don't achieve the things that they could. They underperform, they underwork, they find jobs where they can hide that problem. And so I have patients who won't take on a PA promotion because there would be a meeting where they'd have to take the minutes that would go for 3 hours, and they can't go that long.
So it's about overcoming that stigma, isn't it?
Yes.
What's the first step then? Is it to go and see your local GP and at least just have a discussion?
The GP would be a good start. Now, some of them aren't terribly comfortable either or terribly familiar. We do have a continence health line.
We certainly do, 1800 33 00 66.
And that would be a good first point of call because they'll put you in the right direction.
So what are some of the treatments that can be provided? How do you manage the condition for yourself, Beth?
Well, I've had surgery twice. Pelvic floor exercises are incredibly important as well. One of the difficulties for patients, if I could call us that, when we seek help, is finding out the allied health professionals. So the surgery was fine, but you need physiotherapy to follow up to help you with your muscle exercises, for example. And especially men. We had a paper at the conference on why blokes are not good at seeking help. In fact, they don't even believe they've got a pelvic floor, let alone having to exercise it. As the speaker said, they do know that they have the muscle that stops them passing wind. They just don't always choose to use it.
That said, I think you're saying incontinence affects about 80% of those who suffer are women, 20% men. As far as men are concerned, I guess problems such as if you've had prostate surgery, you may well have that issue to deal with. So once again, you just need to have the conversation.
Look, you do need to talk about it, and it's so embarrassing. It's particularly difficult for men, I think, because they're not used to talking about unreliable bladder and bowel, whereas women it is a little bit easier. But even so, a lot of them will sit at home and not have anything done.
Do we also need to be thinking about preventative steps to take? Because I imagine as we have an ageing population and what have you, and I noted as well that some 50% of cases tend to be for people aged under 50, so younger people, perhaps younger than we might expect, are having this problem. Should we be doing more perhaps to prevent
We should
onset?
all be doing our pelvic floor exercises every day. And in order to do them well, you really need some guidance. So a physiotherapist specialising in that area can be so helpful.
Yeah, on that point, a lot of people, I guess, wouldn't have any idea of what a pelvic floor exercise is. So is there a website that they could go to, just get some guidance there?
Go to the Continence Foundation of Australia website, talk to the helpline. They'll give you ideas and people that you can consult with, but don't just put up with it. It's not normal, and you can be helped a lot.
All right, it has been a very refreshing conversation this morning about a topic that not many of us would embrace on a Sunday morning, but we're very glad we've done so. Dr.
Thank
Jenny
you.
King, Dr. Beth Wilson, thank you both very much for speaking to us this morning.
Thank you.